left bedbound following a COVID infection, has said he feels abandoned by the government. 41-year-old Dr Alexis Gilbert from Burley and Wharfdale caught the virus quite late on in July 2022, but he continues to live with debilitating symptoms including fatigue, pain and brain fog. The government says it is committed to ensuring there are quality services for patients right across the country. Now, over the next few days, we are going to be hearing from people like Alexis whose lives were changed forever by the pandemic. Our health correspondent Jamie Coulson reports.
It's taken away all of my dignity, it's taken away all of my joy, and it's taken away all the most important roles in my life, being a dad, being a partner, being a doctor. It really has been completely devastating on my life.
Before COVID, Dr Alexis Gilbert used to live a full and active life. The 41-year-old was managing a challenging role as a public health consultant alongside being a husband and dad to a young family. In July 2022, he was infected with the virus and after a few weeks of being unwell, thought he was improving. But then everything changed.
Everything started to come back and a lot worse, so suddenly I was so fatigued I couldn't get out of bed and the symptoms just started piling up one after another.
Alexis was eventually admitted to hospital where he stayed for a month. He's since been diagnosed with illnesses including long COVID and ME, which is also known as chronic fatigue syndrome.
I think I'm taking about 73 tablets a day at the moment. It's like someone kept you awake for 3 days straight. You've got the worst hangover you've ever had and you're trying to run a marathon all at the same time, whilst every part of your body is in pain.
Alexis is now almost entirely bedbound and unable to work. He's been sharing his story online to help others suffering in a similar way.
Being a dad was always the most important part of my life, and I feel like I've lost that. I feel like I'm not the parent I want to be, I'm not the partner I want to be, and I can't do any of the things I wanted to do. As someone with long COVID, I felt ignored by the last government and abandoned by this one. I think most of the world wants to get on with ignoring COVID and forgetting about the pandemic, whereas there are millions of us who are still struggling with being severely disabled.
The government says it's committed to ensuring there are quality services across the country for those with long COVID, and that NHS England has a range of support for affected staff. They say they are funding research and joining up health and employment support to help people.
I've lived like this for 2-3 years now, and the thought of living like this for another 2 or 3 years is completely overwhelming, never mind a decade or longer. I try not to think about the future too much because that is a really scary prospect.
Jamie Coulson, BBC Look North.
Thank you, Jamie. Dr Binita Kane is a consultant respiratory physician with a special interest in long COVID. Earlier today, I asked her for her reaction to Alexis's story.
Alexis' story is heartbreaking, and I think one of the problems that we have is we don't really know how many people are severely affected like Alexis, because no one is collecting that data, and by definition people like Alexis can't leave their home and engage in normal healthcare services, so they are hidden behind closed doors. But from the patient charities, we know that there are likely to be hundreds of patients up and down the country like Alexis who are really struggling for support and care.
5 years on then since the pandemic, what sort of support is available for people dealing with long COVID symptoms? Is there much at all?
Well, I think the short answer for people like Alexis at the severe end of the spectrum is no. Believe it or not, in 2025, we still don't have a single commissioned service anywhere in the NHS for people at the severe end of the spectrum. And the long COVID services that were available, and we did really well in the early stages of the pandemic, we had 120 clinics up and down the country, but those are being cut back. The funding is being stripped. And the charity Long COVID Support recently surveyed the clinics, and only 46 confirmed that they were definitely going to be running next year. So there's a lot of uncertainty around what support is going to be available. And of course, there's going to be a postcode lottery as well.
So that feels like we are almost moving backwards, yet I'm assuming that COVID hasn't gone away and the risk of contracting long COVID is still there.
I think people wish it had gone away. We're all COVID fatigued, but actually the virus is still out there. It's there all year round. It's not like flu and some of the other winter viruses that only tend to appear around winter. Now, the risk of long COVID has reduced as the population's become more exposed to the virus and is vaccinated. But scientists generally accept that the risk of long COVID is still around 2 to 3%. Now, that might seem low, but actually, if you've got millions of infections every year, a small percentage of a large number is still a large number of new cases. And so this problem is not gone away at all.
Dr Kane, thank you very much indeed for your time and joining us on Look North this evening.